The Venice Family Clinic is the largest free medical clinic in the United States of America. This past year saw over 21,000 patients come through its doors for over 116,000 patient visits at their 7 different locations in Los Angeles County. The mission of the Venice Family Clinic is to provide people in need with comprehensive, quality health care that is free. At the very core of this mission are the men, women, and children whom the clinic serves. Those with nowhere else to go to receive quality medical care, emotional care, but most of all, human care offered with dignity and respect. Whether it is giving Millie back her smile after 20 years of not being able to afford dental work, giving Noel back his memory with acupuncture treatments after a brutal and senseless assault, or seeking out and giving Michael back the use of his legs with medical relief and education for diabetes, although he is homeless and lives on the street. This is a story of the human heart that pulses at the very center of the medical home that is the Venice Family Clinic, and it will be told through living portraits representative of the human beings the clinic serves and the staff who so tirelessly serve them. Manuel Amador has been coming to the Venice Family Clinic for over 20 years for his primary health care. A member of the working poor, Manuel labored in a local bakery from dawn to well into the night to make ends meet for his wife and 4 children. He put food on the table and a roof over their heads, but could never afford medical insurance. 10 years ago, Manuel's health took a dramatic turn.
We came to see Dr. Lamp because Manuel was having trouble breathing. His health was starting to deteriorate. We were very, very worried.
I started to notice some physical findings suggestive of lung disease, that he had chronically low oxygen levels. I noticed some physical evidence that he had liver disease, and I didn't know how to put the two together. It didn't make sense to me, so I made a referral to one of our volunteer specialists.
Dr. Lamp sent us to a lung specialist. He informed us Manuel was going to need to be on an oxygen tank for the rest of his life. We could not believe what was happening. How would we survive?
I was really scared for my family. The money issue was really big. I was worried I would not be able to work anymore. And in this country, you have to work, or you cannot sustain your family.
Manuel did not heed the doctor's medical warnings, so he could continue working to support his wife and children. Then Manuel got a fever that would not go away. He became so weak, he could barely stand.
Dr. Lamp saw Manuel and said we needed to get to a hospital right away. At the hospital, the doctor said Manuel had acute pneumonia. They said he would not survive the night. I went out to the parking lot. I cried and I prayed to God, you gave me my husband. He has a family. We need him. Don't take him from us. I have faith in you. Thank God my husband lived through the night, but he came home in a wheelchair with an oxygen tank.
Through time, we were able to figure out that he needed a liver transplant, not only to take care of his liver problems, but also to deal with the pulmonary problems as well.
Manuel waited month after month, year after year for his liver transplant.
During that time, I tried to be strong. I could not work for the first time in my life. I did not show my depression to my wife and family because I did not want them to feel worse.
Meanwhile, Dr. Lamp diagnosed Manuel with diabetes and heart disease. She worked diligently to keep Manuel alive, and she also helped him qualify for disability insurance support and be placed on a list for a liver transplant at Cedars-Sinai Hospital.
In this case, he wasn't eligible for insurance until we were able to document that he needed this intervention. So I think for the clinic to be there, in a sense, creating a package so that it's very obvious what his medical needs are.
She guided us. She helped us by getting us the right information, the right people, and the right places to go.
Finally, after 6 years of waiting, a liver became available for Manuel.
He went into surgery. We said goodbye one last time, and we put him in the hands of God. Once again, I asked God to help us, and He did. Manuel now has 100% of his lung capacity back. We give thanks to God and Dr. Lamp.
Venice Family Clinic will be rewarded by God. There are thousands and thousands like me that need this help. We would not even be telling our story here if it wasn't for the clinic and Dr. Lamp. We give thanks. They saved my life.
Thank you, Venice Family